some quick housekeeping, just a reminder. It is a public meeting, so this is recorded. You all will get access to it, as will members of the public after this meeting. Also, again, the chat has been disabled, and so if you do have a comment or a question, please raise your hand or unmute and speak. Speaking direct, that's for the advisory committee members, and then we will at the end have time for public comment for any people who are on here that are members of the public that would like to speak. Real quickly, I'm just going to go through this roster and just call out names. If y'all could just let me know you're here so that we have an idea of who's here and who's not, and then we'll get going. Let's see, Captain Eby.
Here.
All right. Josh Aldrich. Did I get that right?
You did. Here.
Yes. Okay, perfect. I try to remember that stuff, but it's like it's been a week, so please be patient with me. Melanie Manier.
Here.
Perfect. Dan Hoover. Is Dan here? I thought I saw him.
Good morning, everyone. Here.
Good morning. Carrie Peacocks. Let me see here. Okay. Moxie Loeffler. Thought I saw Moxie on here.
I'm here. I had trouble with my mic.
Okay. Yeah. Perfect. Welcome. Orion McCotter. Okay. Grant Hartley. Annalise Dahl. Here either. And Shelia Clark. Okay. Did I miss anybody? Any advisory committee members that I did not name? Okay, cool. All right, let's get going then. Real quickly, this is our agenda today. It's pretty simple. We're just going to go over the proposed rules. You all got a draft of the updated language this week, and so we still have some highlighted parts that we do need to go over. We're going to do a brief review of the rule definition. You guys, y'all requested a map, and so we're just going to go over that, and then we're going to get into kind of the requirements in terms of formula versus competitive. So again, I don't have a break schedule. This is only an hour, but if you all do need a break, please let me know and we can take one. Also, I just want to comment, I have right outside of my office, I have landscapers going. It's like a constant thing at CJC. So if I ask you to repeat yourself, it's because I can't hear you. So I apologize if that becomes an issue. Just a review, this is what we're doing. This is the bill that we are making rules for. Again, the eligible recipients are cities and counties that operate a local correctional facility or federally recognized tribes in Oregon that operate a tribal correctional facility. Okay, so $10 million in other funds over 2 years. That's going to be the project period. And just kind of a reset of where we are. So we're going to move into, if you all have that draft of rules that you received, you can pull it up. So the original draft had those 3 options for rural. Last time we talked, you all settled on this being kind of the definition that made the most sense for this grant program. So there was also a request to see a map with this definition without county lines. And so I just wanted to we're going to show that to you, kind of explain a little bit of what it means, and then get some feedback. I don't think we need to, unless you all feel like there needs to be more discussion about feedback with this language. We don't need to spend a ton of time on this. I just wanted to provide this information to you all because you asked for an update. So this is the definition. I'm just going to ask, are we okay with this language as we discussed last week? Okay. All right, so here is then the map that kind of comes from that definition, and I'll explain it. So the red sections are the red little dots all around are population areas that would qualify as those areas that have 50,000 or more. And so those would be kind of those urban areas. And then if you can look, there's these little kind of blue spaces, blue dots all over. Those are areas that don't quite meet that population threshold, but they do have an amount of people in them, if that makes sense. So it doesn't quite reach that threshold, but there are, there's a population there, a small town or such. And so with that, the circles on here represent the different correctional facilities. And so if you see some that are bolded, that are black, the dark black bolded, and then some that are grayed out, those grayed out ones don't meet the threshold of that distance. Okay, and so distance wise, they are close enough to an urban center that they would not be considered rural by this definition. Okay, so the best example I have, if you look at the area of Corvallis, there's those two dots that have the red. You have Albany next to Corvallis, and then you have those two that are grayed out that have the blue in there. One of those is Lebanon. Lebanon has its own jail, but it is in proximity to Albany. It's within that 25 miles. And so it is grayed out as well. So that's kind of an example. Going back last week with Grant, I believe it was Grant, used the example of Florence versus Eugene. If that was somebody else, let me know. But I think it was Grant. Florence versus Eugene. This does reflect with this definition that the Florence facility would be considered rural, where Eugene, Springfield would not. Okay, so that kind of captures that example, and I know that was a concern last time. Any questions on this as it relates to the language that you all settled on or were good with last week and I can go back to the previous slide if that's helpful. But this is kind of where we landed with that. Moxie.
Hello, thanks. I just wanted to ask, from people who know the topography and the road conditions throughout Oregon, are any of these gray jails in locations that are limited in accessibility at various points in the year? I don't know all the gray areas. I know some of the Salem area. I know Corvallis, Lebanon, and Eugene. I don't see any concerns there really, but between Salem and Portland, down by Medford looks pretty central. Any comments about that?
I mean, just knowing.
Oh, and also Bend.
Knowing where all the jails are and been to all of them before, especially along that I-5 corridor. I mean, Oregon is normal. I mean, if we get enough snow, Portland shuts down. So I think as a general rule, most of them are relatively accessible, even during climate weather such as snow or ice, but it is all dependent, I think, at the time, what the incident is.
I will make note just of the one that's grayed out next to Bend. I believe that is Prineville. And I don't know that I don't think there's an issue in terms of accessibility into Prineville. So that was kind of the only one that's outside of that I-5 corridor. So any comments or questions on this? Any feedback? Are you all comfortable based on this map where these locations are, how the population centers are, along with kind of that distance component to the definition? Is this a definition you all are comfortable with in using for this grant program? And the reason why I'm asking is because we are going to move to kind of that formula piece. And so I want to make sure if the rural component plays a part in that, that this is a definition that you all are comfortable with. And you don't have to sit, go, oh, sorry, go ahead, Josh.
I think this is a super cool map, and thank you for putting it together. I've never actually seen it like this before with populations around it and geolocation, so very cool. And I think it's great for the purpose of what we talked about too.
Okay. Okay.
I agree.
Perfect.
I appreciate the map, and I don't have any reservations about that definition. Thank you.
Okay. Perfect. Okay, so we are going to move on. If at any point we, you all need to see this again, if we're talking about other things, just let me know and we can go back if this is something that comes up. So, good. Thank you for that, and appreciate your patience as we try to get the language on this definition. It is a little bit difficult and I think more complex than people realize. So I appreciate that. Just wanted to touch base on this really fast. There was a change in here. We did get some feedback on 3B. I just wanted to make sure we used kind of the language. Melanie, I believe you provided the majority of the language along with somebody else, sorry. And we just kind of wanted to make sure we did kind of rush through this as well at the end. And so just wanted to give you an opportunity to look at some of those changes in the language, and then also any other comments on any of this language as well. We do have a little bit more time today if you want to take some time with it. Captain Evie?
I also just kind of to make sure everybody's on the same page when as we're talking through these, not only the requirements, but also when you're talking rural, it's not excluding anybody from applying. It's just for formulas determining amounts and funding. So I just want everybody to make sure that. So when we're looking at that last map, we're like, oh, these guys aren't who's rural when we're defining. It doesn't mean people aren't able to potentially apply for the funds.
Correct. Yes, that's a great point. So there's a couple of spaces. One of them, when groups apply, CJC staff, the first thing that we go through is look at eligibility. And so eligibility is clearly defined in the bill. And that is something that's the first threshold that any potential applicant has to get through. And then these are along with that definition of rural, these grant requirements and any sort of formula that we do are then applied to those eligible applicants. And so that is that first threshold. So thank you for that clarification. Any comments on this? I just want to make sure everybody's comfortable. We did review this. Otherwise, we can move on. Okay, perfect. Okay, so if you look at your draft that you have, if you go a little bit above the language where this is, I would like to, if we can, start there. And so it's going to be kind of two parts where we're looking specifically at the review criteria at the bottom of these rules. But I want to start here with this language in particular. And so the point of this language, or the discussion point, I guess, is two parts. So is there a recommendation between a formula or a competitive? So we need a recommendation from you all whether or not a formula or a competitive process makes more sense in terms of distributing funds. And with that, this is kind of some of the language that would be this would be the language that we would need feedback on if you all went to the formula route, if that makes sense. So are these factors that you all would like to consider if formula is the direction that we go? If it's competitive, then we would take this language out of this section, okay? And then we would get feedback on the review criteria for competitive. Okay, so that's kind of the two pathways. If they're in Captain Evie, I see your hand. Just let me, if you can, just okay. So what I want to just make clear is feedback on this language and how this is going to function within the rules is all that we need from you all, okay? And so if there's any need for specificity, or if there's any change in the language, or if something doesn't make sense, then that is the kind of feedback that we need. And so once these rules have been submitted and there's been a public notice and then they become permanent, we can then form a work group with CJC staff and kind of work out, and others, and work out what that formula actually looks like. And so we don't need that level of detail today. We don't need you to define the formula or work through what that formula actually looks like. We just need to we need to understand or consider what factors need to be included in this language. Okay, did that make any sense? Okay, sorry. Okay, so first of all, let's start with the idea of a competitive versus a formula, and any feedback on whichever route makes more sense. So, Captain Evie, thank you for your patience.
No problem. So I'll start off by saying I would support a formula method, being that sit on other boards too in Oregon. I see the need is across the state. And I think that taking the funds and spreading it across the state for a formula would help in the largest number of individuals who are incarcerated. And so I would start off the conversation by supporting a formula method. And again, the comment or section that you put there, I think, is a good basis for start. And then we can kind of see what that actually looks like based on actual numbers to see if this is accomplishing what we need. But I would start off with a support for a formula, not a competitive.
Okay, thank you. Moxie?
Yes, thanks. I think that it was reassuring to me to hear you say that the formula can be created later. I think there's certainly a number of, I think the benefit overall lies with using a formula, because I do think that there's a need across the state, and it's hard to compare any part of Oregon with another part and really make people compete to demonstrate that their application is stronger or they'll be more effective. The other issue I think with formula that I would just keep in mind is that whenever we use rates and epidemiologic measures, we are often, I think, liable to exacerbate inequities between regions. So if the data gathered in one part of Oregon is better than the data somewhere else, it'll look like that place has more need, when in fact that may not be the case. So with the pandemic, if you looked at it globally, you would see that COVID rates in Africa seemed super low, but then you would hear stories on the ground that people were struggling massively with the disease. So it matters a lot, the infrastructure that exists to do medical examiner reports, to evaluate deaths. Do the deaths get evaluated accurately? In studies of death certificates, there's a fair amount of inaccuracy. I mean, as someone who has completed these for years, when patients die, we don't always know why, even if they're in our care for weeks in the hospital. So I would just keep that in mind, maybe leaving out overdose rates and looking more at the number of people in the population. We did get a report at the ADPC that I could email you or put in the chat, if the chat were enabled, that showed like the rates throughout the state. And there were counties with no data at all. And there are counties where the rate goes up and down every year because of the small numbers. So those are just factors to keep in mind in terms of the mathematical impacts. Thanks.
Perfect, thank you. And if you could email me that would be super helpful as we kind of move into that, because obviously down the road, we are gonna have to consider data sources and where we get that stuff. So thank you so much for that feedback. Daniel?
Yeah, thank you, Moxie and Captain Eby, for the comments about formula grants. I'm kind of asking the group the question, or just considering that with a formula grant process, are there ways that we would be able to help jails guide towards using best practices for their MOUD programs if it's not a competitive grant, basically? And I can say, like, something I'm thinking of, for example, is that for jails I work with, I am telling them to adopt a model like what we do in the hospital care setting, where patients are offered starts onto MOUD when they book into jail, and then they can stay on the medicine. And that's compared to a model of only giving MOUD to people pre-release, where they're not offered it at booking, and they have like this long stay in jail where they're not offered access to medication. So I do have opinions about like what a best practice kind of program could look like. And I'm curious how we might encourage jails to do things in line with best practices if we're not using a competitive grant.
All right, thank you, Daniel. Captain Eby?
I was just going to respond to Dr. Hoover. I think looking at your last slide, I think it was the one before this one where you kind of talk about the other requirements for the there. Again, you're talking, it kind of puts some of that in there, I think, and you still have to, while the money would be formulated, they still have to apply for it, meaning it just doesn't appear. And so they would describe what they're using the funds for, obviously providing the medication, telemedicine. And I think as an overall view, we would want them to use, best practices, right? I think that is the general rule of thumb across any type of MOUD. And so we could put that in there as part of that application requirement, that if you want these formulated funds, here's what you have to use it for, and ensure that they meet those one of these things, plus making sure that it's a scientifically or medically approved process.
Thank you, Captain Eby. So with this then, with Daniel's comments, Captain Eby, Moxie, it sounds like everybody is on board with formula. Is there any comment on the competitive route? Anybody have any feedback or comment on that?
I guess I will just share some feedback that came from the initial work group during the same discussion, and that was a concern over the general amount of dollars available and how much a formula grant would limit that opportunity for certain places. When you break it up 40 ways, it doesn't leave a whole lot. And so I prefer the idea that it's a formula grant also. I just want to put that out there because it was a pretty significant part of the discussion initially.
Just so I'm clear, just the concern that certain areas would be limited in what they kind of qualified for in terms of getting funds based on the formula that was developed. Is that accurate?
I think it really, absolutely. It comes down
Okay.
to the development of that formula again, and ensuring that there's equitable financing available even for those smallest of places, because starting a program has costs associated with it regardless of how big your facility is.
Okay. Thank you for that feedback. That's great. Moxie?
Yeah, on that note, I just, while you were talking, put in 10 million divided by 40 and you get $250,000 if you gave it out evenly to everyone. So we might want something in the administrative rules that that looks at not just do places qualify by the formula, but will the ultimate grant amount given really impact that jail's ability to provide the care? Because one of the issues that I've heard from people who have applied for state grants is that while they greatly appreciate the existence of the grant funding, that it ends up sometimes not making a big difference, and it's a lot of effort to comply with the grant, administer it after you receive it, but that sometimes the amount of money ends up being too small for what we're trying to accomplish. And I know we're trying to do really basic things, partly so we can enable the jails to take advantage of the Medicaid 1115 waiver. But I certainly agree about spreading the funds thin. Thanks.
Thank you. Captain Evie?
I just kind of jumping on what Josh said, and yes, there was a lot of that at the beginning when we were discussing this. Unfortunately, the legislature chose an amount, and that amount is what we're dealing with today. And obviously, if we could throw all that $10 million in one area and then hopefully make a huge bang, or, but then you're going to lose those other areas of Oregon that are also being impacted. I'm hoping, obviously using a formula, not everybody's going to get that amount, exactly split up evenly. There will be some more and less, but it really is that start for facilities to either expand a little bit or begin, hopefully for the next couple of years as other funding comes through, including the waiver, the 1115 waiver. And so I think we just need to be aware that 10 million isn't going to solve our problem. It's just not. But I'm hoping that it will help a lot of facilities. I know a lot of them will. Just a little money will help them start going in a different direction and start instituting stuff, because budgets are tight out there, as we all know.
Absolutely. Thank you. So let me just kind of put a thought together and then I'll ask a question. So going back to Daniel's comment about best practices and kind of these grant application requirements that we do have written out, that we did go over. And so kind of that idea of they are going to have to meet best practices, potentially get there in the planning stage. And then also this concern about areas getting, and again, this is kind of what Captain Evie said, we don't have control over the amount, but the concern that areas get the right amount of funds needed for this to make any sort of difference, right? And to help out. And so kind of with these two discussions, is there a need for these points? Is there a need for specificity? Is there something else that needs to be added to this language when referring to the requirements and a formula itself? Is there a need to add specific language to this, or other factors that should be considered within this section? And what we'll kind of get to the last section with the review criteria with the formula is pretty I can move to it actually, so you all get kind of the big picture. This is it. Okay, it's pretty bare bones, and one refers to what we're talking about right now. Okay, and so that's kind of, and with the requirements, and so that's why I'm kind of asking if there's a need for language that needs to be considered in this section, if there's anything that needs to be added or considered potentially in this section. But this is actually pretty simplistic. We're not, like I said, we're not gonna map out the entire formula. That will come after we get these rules in place. But that doesn't mean that there can't be some specificity in this section, as well as the application requirements from you all. Does that make sense? Does everybody kind of understand where I'm coming from with this? Moxie.
I just wondered if you could share your screen with that text again.
Which one?
With the text that you were saying, does this need anything added?
Oh, so this right here is, if you look at the draft of the rules that we sent out, this is in the application requirements. And so this would establish that this is a formula grant, okay? And then I might have these out of order. So and then this right here would then say grant applicants must. So this was to Captain Evie's point and Daniel's concern about best practices, right? And so hopefully the language in here would capture that. And then we have a section in the review criteria that then refers back to that requirement section, that they have to meet all of those requirements. Okay, and then anything else that the commission decides that they want to include, okay, any other criteria. And so with that, is there a need in this section? And I know I'm going back and forth, and this section for more clarity or more specificity so that it is captured in the review section of this formula. Does that make sense? So when we are able to, when we review TZHE staff, the grant review committee and the commission reviews these applicants, right, in terms of funding, right? This is the review criteria, so it circles back to those application requirements. That's where the review criteria comes from within that formula, okay? So question is, do we need more specificity in this language to capture everything that we're trying to capture? I know that's a lot. Daniel, I think you had your hand up first. Moxie, did that answer your question? I'm sorry, 1 second, Daniel. Did that kind of make sense, Moxie, in terms of what you were asking for to see the right language?
I think what I'm missing might just come out in the discussion. I
Okay,
think it's, what I'm wondering is the question about what's missing, because we're looking at parts of the administrative rules that we're recommending. I'm lacking the context at this point, and so I'll just listen.
okay.
And
And
it may help.
if it's helpful, I can also show a Word document if I need to. If you all, it will be the same draft that you all received in your email, that PDF. You should have all gotten a PDF of the draft rules. And so we're looking at the grant application requirement section as well as the grant application review criteria. So that's kind of where we're going right here. Sorry, Daniel, I didn't mean to interrupt you. Go ahead.
No problem. Yeah, I think I'm interested in including some language that they're meeting a criteria of having a program design that is not exclusive to only a certain period of the jail stay for when they're offering access to their MOUD program. And that the guide would be to begin offering the MOUD program at jail entry. And we could put some time frame that's reasonable to do, like intake procedures and medical intake, but would want them offering the MOUD program at jail entry and then allowing people to be on it until release. And as I mentioned, the things I would not want them doing that I don't think are best practice is waiting until only close to release and then starting the medication. And then I'm sensitive to and interested in input from everyone, because if a jail is receiving like a small amount of funds compared to their population, they might say, well, we just can't make the funds work for that. We need to prioritize a target population only at release or something. So I'm sensitive to that and interested. I don't want people to not apply because they can't meet the best practice with the funds being available. But I think if we don't make sure it's offered from booking all the way to release, we're going to have issues that we're already having where we're seeing overdoses in custody and more suicides because people aren't on the medicine that would be benefiting them throughout the whole jail stay.
Okay, that's a great point. Thank you for that. And is this language something that you would like to see in this section or this section?
Well, this section that you put on the screen now is like directly out of the bill. So are we able to, I mean, maybe it should go in this section that you're showing now. I don't have a strong feeling, and maybe I'm not enough familiar with the process of what would be better.
Okay, and that's okay. I just wanted to make sure I was clear with my notes. But yeah, no, that's fantastic feedback. So thank you for that. Captain Evie?
Before we jump in, because I wanted to talk about the page you're currently on, Melanie might be jumping on what Dr. Hoover has to say, so I'll defer to her first because mine is on a totally different topic.
Okay. Melanie?
Okay, so I agree with Dan to an extent for the best practices. I am trying to conceptualize that for jails that have no programs in place. And I think that if we make statements like this, I think we are going to create a whole separate exclusion criteria for people. Understanding that if we divide this amount of money by, the 40 facilities that could be eligible, it's $250,000, which is not a lot of money when it comes to facilities that don't have nursing staff many days a week or even 24 hours a day, who the deputies are the folks who are actually administering the medications, or maybe there's some self-administering of the clients. I think that $250,000 probably doesn't pay for one deputy, let alone the multiple deputies it may require to cover all of the shifts that would be needed to cover in the facility, right? So I think that if we, while I love the idea of best practices, and I do think there should be some consideration, I don't think it should be an overall requirement to enter into the consideration for the formula, right? Or I don't want it to exclude facilities who need the help, and maybe in their need of help, they can only do so much in the beginning, and once they start, they can move forward to something else. But I don't want to exclude jails from participating with criteria that makes them feel like they have to do something that they really are not able to do yet.
Okay. Captain Evie, I have a feeling Daniel has a okay. Go ahead, Daniel, and then Moxie, you can go after him if you'd like.
Yeah, I think Melanie, you're making a great point. I guess what I would continue to be worried about if a jail implements an MOUD program that has like partial access to a more selective population than everyone who has opioid use disorder, or it's more selective based on a point in time, like it's only 2 weeks before you release or something. Then you create a dynamic of the haves and the have-nots, and you promote more diversion in the jail. And I think we could just see a lot that we're actually generating problems from program design like that. So I don't want to give jails who are putting a toe into this for the first time kind of a bad experience of having half a program, because that's that's all they could afford with the grant funding or all they could staff. So I am like worried about that, but I see a lot of downsides to also like letting them kind of step halfway in with half of a program or something.
Moxie, go ahead.
Yes, thanks. I can appreciate both positions that Melanie and Dan expressed. One being some of these jails don't have all the resources they need to offer medicines all the time to everyone, but also wanting to build that quality of care standard. So I wonder if we could put into the rules something about that the grant application has to demonstrate that the program is, that it's feasible, that it will grow, and that it will eventually meet the standard of care, especially with the 1115 Medicaid waiver becoming available, and also with the new telemedicine permissions for buprenorphine. The geographic barriers to prescribing are much lower than before. So I wondered, could we say something like within 1 year of receiving the grant, they will be working with a community partner who can prescribe buprenorphine to anyone at any point during their jail stay. That way we would allow for the flexibility of new programs, and also require that there's some like attention and momentum towards quality care.
Okay. So still a timeline as like Daniel recommended. I know your timeline was while they were in, but also for those ones to kind of address Melanie's concern that they may not have the infrastructure for that yet. Demonstrating that they will, or what they're doing to get there is kind of what I'm hearing. Okay,
Yeah.
perfect. Perfect. Okay.
Can I
Yep.
just tell you one more thing that the Rural Health Information Hub has a really good website that talks about how to plan for sustainability, and the Georgia Health Policy Center has these principles that they use to define what a sustainable program looks like what the features are. And so I think about that in terms of starting something brand new and building it up to a standard that kind of model could be helpful. Thanks.
Okay, thank you. Orion, and then I'm gonna go Josh and then Captain Evie, if that works.
Sure. Thank you guys. And I greatly apologize. I was coming back from traveling and missed the first half of the meeting. So forgive me if I am not aware of previous conversations, but I really want to echo kind of what Moxie said, to follow up with both support of what Dan said and support of what Melanie brought up, that I think this is like a major crux of the issue, that this is really aimed to try and start building jail programs that are non-existent. And I think that we're going to run into a lot of issues if we want them to start with a full spectrum as the best practices that we would want, offering to anyone that might need MOUD at the time that they come in, and the many challenges that are inherent with the short stays and unknown time of release for people. So I'd really recommend thinking about that, and wouldn't want that to become part of the rules advisory there, because I think we could really get stuck with how we're able to support some of these new jails starting a brand new program. And so would really want to try and think about ways that we could do that at least that they are showing effort to meet best practices, or showing a timeline that they're going to work towards doing that, but not expecting that they're going to have all those things worked out initially when they start. And so however is figured out to do that, I think would be fine, but really want to make sure that it's not a penalty to the program on the application process.
Okay, thank you for that. Josh?
I just want to make sure Lee's not ready to talk first. I like listening to Lee talk. Okay.
No, you first.
I think I'm just echoing what everybody else is saying. But I worry about us putting so many rules in that some of these smaller jails feel like they can't even participate. And some of the things that have been discussed, I made notes of. As far as I know, the state has not made a long-term commitment to this money. And so I think expecting the jails to make a commitment, anything beyond this funding period, as to what they can do, I just don't see how we could make that work. I know that there is this 1115 waiver process that's in the works, but I want to remind everybody that 1115 waiver is not going to cover adults in custody the entire time they're in jail. It's for a very short and defined period of time. And so coming from a county, and I think I can say it for all of the county jails, who's funded almost exclusively in general fund dollars, we're already looking at budget cuts consistently over the next 3 years forecast. I worry that if we ask people to do more than they're ready to do right now, that we may just basically put in the rule, you counties don't even try, because you're not going to be able to maintain it. And I know some of our partners in super small jails, they got 30 people at any given time in their jail, could use the help for just 1 or 2 people as much as any of the rest of us with bigger jails. So anyway, like I said, I don't think that's anything new. I just wanted to kind of echo the fact that, and I will also add this one more little piece. All of our jails are ran by elected officials. And so another thing that goes along with long-term commitments is that while our current sheriffs may support the work we're doing in this area. There's no guarantee that sheriffs that are elected in future cycles would. And so I'd hate for a county to commit and then look like they're not trying to follow through with their commitment if things were to change politically. Not that I think there are any sheriffs that wouldn't support this now or in the future, but you never know what's going to happen.
Thank you for that. Captain Evie.
One, thank you, Josh. I appreciate what you said, and I think I totally back 100%. You know, we are dealing with a finite amount of money to try to create very large programs, and it's going to be very difficult in a short period of time. So any effect we can, I think is success. So we got to be careful. Going a little away from those rules a little bit to the application requirements, I just want to put on the radar. It says the commission is to determine the portion of grant funds available to tribal correctional facilities. Currently, there are none that I'm aware of, and I checked, that are operational. So the commission does need to address that as we move forward.
Yes.
If there's one that is, I'd love to hear it, but I don't know of any currently.
Yes, thank you for that. Yeah, that's something that if this and to Josh's point about it being, we know that there is at least one round with this grant with applicants. If that does continue, that might become something that is applicable, that we would have to go to the commission for. So, but thank you for pointing that out. I appreciate it. Okay, so we have about, oh, Josh, go ahead. I'm sorry. Do you still have your hand up, or?
I got to unmute myself though. Talking doesn't help. Thinking about another recommendation, be outside of what we already discussed. I don't see anywhere in this section 3 that it discusses administrative costs. Is that something that's allowable? I know that that's a big chunk of what people are concerned with entering into this.
Yeah, so thank you for bringing that up. That is something that will be addressed within the solicitation. That CJC, we kind of have our own administrative ask process that we address in our grant administration guide, as well as our solicitation and kind of that process. So it is in another place and will be available, but it won't live in the rules, if that makes sense. But they will get, they will, the language will be elsewhere where potential applicants will be able to see it. So yeah, but thank you for pointing that out. Okay, so we have about 10 minutes left, and I do have to leave room for public comment, but I just want to make sure we have settled on formula. And so this language will be in some way in rule in the application requirements, as will this is also, it's pretty simple. Again, it kind of refers back to the previous section. Part of the reason why this might be a bit confusing in drafts is we haven't named these yet, the 000, because we haven't named the rule yet. Sometimes that's hard to kind of link back. So I apologize if that was a bit confusing in terms of where to look. So I'm sorry. And then we are gonna get rid of the language for the competitive. So this was also in the draft rules. If you all are good, we will remove this language and go with the formula for review criteria. So I just want to kind of summarize this discussion. Is it okay? And I'm not quite sure yet, and this might be a discussion for next week, but based on this feedback and kind of a need for some direction in regards to best practices and potential programs that are starting out and trying to put something together. Can we put some language together for you all to react to that will either go in the requirements like this list, section 3, or add some specificity to this? Because I'm not quite sure where you all, and that's okay, where you all would like it. But based on kind of this discussion, is it okay if as staff we develop some language to try to capture this conversation, see if it's something that you all would recommend, and then where to put it? Is that something that we can do for next week? Okay, I'm getting some, okay, perfect. Moxie, did you have a comment?
Yes, thanks. I wanted to say, I think that there's a potential bridge where we could reconcile what I think it was Commissioner Eby was saying with what Dan said about quality. I think that maybe what we could do is say that the jail would need to offer at least buprenorphine sublingual to all of the people in custody from the time of booking to release, if that time period is 90 days or less, because as I understand it, we could check with Katie Beck at OHA. I think the 1115 waiver would cover billing Medicaid for 90 days in custody and also prior to release from prisons. So I think a 90-day language would make sense, as well as language that shows that the program has to have a feasible plan to offer medications within for those 90 days on the horizon within a year or so. Not language that would make them liable for failing to comply, because like someone said, a new sheriff could get elected and then you're out of luck if they don't support the program or there's a budget cut. I mean, we could build in some flexibility about unforeseen circumstances that interfere. What do people think about that?
Ryan, you have your hand up. Did you have a comment?
Yeah.
Okay,
I
response.
think that's a good approach, Moxie. That is still, so the Medicaid waiver, the 115 is still in process, with finalization with CMS, between OHA and CMS. But yeah, I think if it was something that was aimed to build into that talked about the 90 days would be meaningful and at least like an indication that they were trying to meet that. And then just for the record, like Katie Beck did step away from that position, and then a couple other people in that role right now.
Okay.
I still have concerns with that specificity. I mean, we might have jails in Oregon that don't even know how Suboxone is administered at this point, who I would love to see get a foot in the door in the program. And I completely understand the intent, and I think it's super worthwhile and would love to see that expansion maybe in the future. But I would also love everybody to get an opportunity right now to do something right, even if this helps fund their ability to begin developing those relationships in a plan. I don't know.
Okay, thank you. Molly, did you have your hand up, or are you?
I did. I was going to say what Josh said, and then I was also going to add in section 3A, I think it is, unless the sections are labeled differently, there is that capital A, that provide medication, telemedicine, or other reasonable treatment to persons in custody with opiate use disorder. I think that covers that statement to have people offer medication, but I agree with Josh. I think, again, if we get too specific on what we're requiring of people, I think we're going to see a lot of people choose not to apply, and that was not the intent.
Okay. Just a reminder to kind of put some of this in perspective on the kind of the grant process itself. The rules can provide a guardrail, right? And so it can be, here's the guardrail of how this grant itself is going to operate. And specificity, if it's not necessary, or if it's not, if there's a worry that it would prohibit or narrow this grant program, that specificity can go elsewhere, right? And so application questions can establish that specificity as it relates to best practices, or when they're doing whatever needs to be done within their program, or when they're planning on it. And it can also be offered in the solicitation. Okay, and so if there's some hesitance to add specific language here, that's okay. It can go elsewhere. But we just want to make sure that if there is a need for it here, that we get it, if that makes sense. And so there's kind of that balance where we can capture, like next week, I think we're gonna have to push the last slide that we have, the last section about efficacy, in terms of data, right? And so we can talk about specifics with that. That's a great example of where that specificity can be captured elsewhere. Okay, so that kind of, because I know there's this kind of back and forth with how detailed to get. If it isn't in the rules, but it is something that is important for these programs in terms of best practices, it can be captured in other ways, if that's helpful as well. Okay, we just have a couple more minutes, and I do need to get to public comment. So just if you all, Daniel and Moxie, if you could quickly, I do want to get your comments in, but
Sure.
just a little quickly.
I was just going to say, thanks for that idea, Rachel, of putting more specificity in the application. And I would feel content with that and directing folks towards best practices in that way. I'm interested to see when we talk about kind of efficacy and outcomes. I do continue to have that concern, especially as we think about sustainability, that if you implement like a very partial or selected program, you can't expect the same kind of results. So someone might say, well, why are we still seeing an overdose here and there in the jail, or vice versa? And so, but doing what we can is really important now. So
Perfect. Thank you. Moxie?
Yes, thank you. I just wanted to say that the phrase any other reasonable treatment may seem benign, but in addiction medicine, there are a lot of non-evidence-based practices, and actually practices that run counter to evidence and increase the risk of death for patients, such as abstinence-based programs, especially withdrawal management programs, where people don't get medication. They actually are more harmful than if you did nothing at all for the patient. So I think when I think about resource use and the potential to maybe divert funds towards programs that don't have medication, and then programs that have medication might need to be smaller or treat less people, I think that's a substantial loss to public health. And that certainly could be covered in the application and the way that applications are evaluated. It doesn't have to be put into the requirements in a way that it dissuades people from even trying. Thanks.
Okay, thank you. Okay, I will get to public comment real fast. So if there's anybody that is not on the Rules Advisory Committee and members of the public that would like to make a comment, this is your time to do that. Just raise your hand and you can speak, and just please keep in mind that we are not able to answer any questions. So just statements only. And I don't see anybody. Okay, thank you all so much for today. We are going to fix the draft rules that, based on the feedback here, we will try to come up with some language based on the discussion regarding specificity or the need for it for next time, and we will present it and see what you all think, whether or not it's necessary to add it or if it can go somewhere else. We are also, I do have a slide on the evaluating efficacy section of the rules. And so we will be talking about that, again, asking if the language is correct or if there is a need for specificity as it relates to data, and where this grant actually is going to start, and then the expectations as it continues. And so be thinking about that for next week. Any other comments, questions, any sort of issues? Is everybody okay with that for next week? Okay, I believe we are next Wednesday at 9, so it'll be a good morning. We will have another hour to go, and then we will hopefully get the language that we need for these rules. So appreciate you all being here today. This was a fantastic discussion, and we'll see you next week.